The shunt murmur, the true murmur in the patient is absent. The shunt murmur is found to be absent. Shunt murmur is absent, but flow murmurs, these are atypical murmurs due to aberrant flow. They may or may not be present in the patient, but they are not typical. The typical shunt murmur in ASD is absent. ASD, the complications are rare, and infective endocarditis, IE, is not seen. This is a past FMG PYQ. Which congenital heart disease has least risk of developing infective endocarditis? The answer is atrial septal defect, and that is why you don't need to give infective endocarditis prophylaxis. What is the treatment in the patient? The treatment in the patient is surgery. If they ask you, it is a NEET PG question. Ideal age of surgery is 2 to 4 years. Ideal age of surgery is 2 to 4 years. Hassan Imam, pan-systolic murmur is not heard in ASD, it is heard in VSD patient. So remember the funda. If the examiner is saying pan-systolic murmur and examiner is saying wide variable splitting of second heart sound, and it will not be asymptomatic, patient is having congestive cardiac failure and pneumonia, this picture is pointing towards a diagnosis of ventricular septal defect. Remember, so watch out for the keywords, watch out for the important points, and you will always get the answer correct. So this is a quick review of the topic, atrial septal defect. The answer to question number 2 is C. Let us go further. Question number 3. Which of the following is the height velocity in the first year of life? Atypical question, but based upon what we already discussed. What was the height velocity in the first year of life? How much child gains in the first year of life? It is 25 centimeter per year, and that is the answer. So question number 3, the answer is C, 25 centimeter per year, already discussed above. Already discussed above. Next, we come to question number 4.